Do something for me right now. Swallow, just once, and pay attention to what you feel at the back of your throat. Is there something sitting there? A thickness? A coating that doesn't go away no matter how many times you've already cleared your throat this morning? If this sounds familiar, you're not alone, and you're probably not dealing with something mysterious. You've likely been clearing your throat dozens of times a day for a while now. If I asked you exactly when it started, you might struggle to answer. It tends to creep in slowly, first just in the mornings, then gradually throughout the whole day, until eventually it just becomes part of your routine. You carry water with you everywhere. Maybe you've cut certain foods out of your diet because they seem to make it worse. You've probably tried whatever remedy a friend, a neighbor, or a family member swore worked for them. And yet here you are, still dealing with it. Here's what I want you to walk away with today. This symptom is not random, and it's not simply getting older. Persistent throat mucus almost always has an identifiable, explainable cause, sometimes more than one working together. The problem is that this symptom gets dismissed constantly. People are handed lozenges, told to drink more water, and sent on their way, while the actual underlying cause sitting quietly underneath it all never gets addressed. I want to change that today. I'm also going to point out something that most explanations of this topic skip entirely. 2 of these 5 causes tend to show up together far more often than people realize, and when they do, they tend to make each other significantly worse. Understanding that overlap is often the missing piece that makes everything finally click. Let's start with a bit of biology that almost nobody explains clearly, because once you understand this piece, everything else makes a lot more sense. Your body produces mucus every single day, constantly around the clock. That is completely normal, and honestly, it's a good thing. Mucus is your airway's protective coating. It traps dust, bacteria, and viral particles before they can travel deeper into your lungs. It also keeps the delicate tissue lining your throat moist and flexible. Without it, your airways would dry out, crack, and become far more vulnerable to infection. So mucus itself isn't the problem. The problem is what happens to that mucus as the body ages. Here's the part almost nobody explains. Your airways are lined with millions of microscopic, hair-like structures called cilia. Their job, performed constantly without you ever noticing, is to sweep mucus upward and outward so it never has a chance to accumulate. This system is called mucociliary clearance, and in a younger adult, it's remarkably efficient. Mucus gets produced and cleared almost as fast as it forms. But research on aging airways has shown fairly consistently that ciliary function slows down over time. The cilia beat less frequently and less effectively. The practical result is that mucus that would have been swept away in seconds at age 35 or 40 can sit and accumulate for hours at age 65 or 70. What that means for you is simple but important. Any factor that pushes your body toward producing a bit more mucus, or thicker mucus, is going to be far more noticeable in your 60s and 70s than it would have been decades earlier. This isn't a flaw in your body. It's not a sign that something has gone catastrophically wrong. It's simply the physiology of aging airways, and understanding that foundation is what makes the next 5 causes make sense. With that context in place, let's go through them one at a time. I'll also flag which 2 tend to overlap and reinforce one another, because that combination is worth understanding on its own. The first cause is one that research consistently identifies as one of the most frequently overlooked explanations for chronic throat mucus in this age group. It's called laryngopharyngeal reflux, sometimes shortened to LPR, and if you've never heard the term, you're far from alone. Most people are familiar with classic acid reflux, the burning sensation in your chest after a heavy or spicy meal. That's the version everyone knows. But there's a quieter, more deceptive cousin of that condition. This version doesn't come with chest burning. It doesn't come with obvious digestive discomfort of any kind. What it comes with is a throat that simply will not settle down. Here's what's actually happening physiologically. At the junction where your esophagus meets your stomach, there's a muscular ring, a valve, whose entire job is to stay closed once food has passed through, keeping stomach acid locked below where it belongs. As we get older, that valve can gradually lose tone, somewhat like a rubber band that's been stretched one too many times. When it doesn't close completely, small amounts of stomach acid can travel upward, not just into the esophagus, which is at least somewhat built to tolerate acid, but all the way up into the throat, the voice box, and sometimes even the back of the nasal passages. This next detail is the one that makes LPR so easy to miss. The tissue lining your throat is nowhere near as acid-resistant as the lining of your esophagus. Even a tiny trace of stomach acid reaching your throat is enough to trigger an immediate protective response, and that response is exactly what you'd expect. Your body rushes to produce thick mucus to coat and shield the irritated tissue. It's a completely logical defense mechanism, but if this is happening quietly, night after night while you sleep, you wake up every single morning with that familiar heaviness sitting at the back of your throat. And no obvious reason why, because there was no heartburn, no chest discomfort, nothing pointing you toward your stomach as the source. Some research published in ENT and voice disorder literature has found that a substantial share of people diagnosed with LPR, in some studies, roughly half-dots, report no classic heartburn symptoms at all. Just chronic throat clearing, a voice that sounds rougher or hoarser first thing in the morning, and mucus that seems to be waiting for you the moment you wake up. A few honest questions worth asking yourself. Is your throat noticeably worse in the morning compared to later in the day? Does it seem to get worse when you bend forward or shortly after lying down? Has your voice sounded different, rougher, or lower right after waking? These patterns are common fingerprints of silent reflux, though of course only a medical evaluation can actually confirm it. One more detail worth mentioning here, because it's easy to overlook. If you regularly take anti-inflammatory medications for joint pain, ibuprofen or naproxen for example, research has shown that this class of medication can reduce the stomach's natural protective lining over time. That can make acid reflux, including the silent LPR version, more likely to develop or worsen. If you take these medications regularly, and you've also been dealing with persistent throat symptoms, that's a connection worth raising directly with your doctor. It's not something to diagnose yourself, but it's absolutely worth bringing into the conversation. The second cause tends to arrive quietly and stay unnoticed for exactly that reason. When most people picture sinus problems, they picture the dramatic version. Intense facial pressure, a throbbing headache, a nose that's completely blocked. The textbook sinus infection. But in a lot of adults over 55, chronic sinus inflammation shows up almost invisibly. Breathing feels mostly normal. There's no major headache to speak of. And yet the sinuses, mildly swollen, producing just slightly more mucus than usual, are draining steadily and quietly down the back of the throat, hour after hour, all day long. This is what's known as post-nasal drip, and interestingly, some recent research has pointed to adults in their mid-50s as a common age group for this kind of presentation. That's not really a coincidence. It tends to line up with gradual changes in sinus tissue and airway function that accumulate over the decades. Here's where a lot of people get stuck. Many people dealing with this have spent months, sometimes longer, reaching for over-the-counter antihistamines, assuming the culprit must be seasonal allergies. And there's a reason that strategy often disappoints. Antihistamines can dry out mucus temporarily, but they don't do anything to address the underlying inflammation inside the sinuses that's driving the excess production in the first place. What's left behind is often mucus that's thicker and stickier than before, sitting at the back of your throat and arguably more uncomfortable than the original issue. The approach with the most consistent research support here is refreshingly simple and inexpensive. Regular saline nasal rinsing. This means using a saline solution, either a pre-made saline spray, or a homemade solution using distilled or previously boiled and cooled water with a small amount of salt to physically rinse the nasal passages. A number of clinical reviews looking at evidence across various sinonasal conditions have concluded that nasal irrigation is a genuinely effective, low-cost, and low-risk strategy, both for treating active symptoms and for reducing the frequency of upper respiratory issues over time. It's widely recommended by ENT specialists as a supportive adjunctive treatment alongside anything else your doctor might suggest. The mechanism makes sense too. Saline rinses physically flush out inflammatory mucus, help reduce swelling in the nasal lining, and support that ciliary clearance function we talked about earlier, the very system that tends to slow down with age. The single most important factor here is consistency. Using a rinse once or twice will typically give you a day or two of mild relief, and then the effect fades. Daily use, done correctly, over a couple of weeks, tends to be where people start noticing a real cumulative difference. It's not a quick fix. It's a habit that pays off over time. The third cause is one that tends to surprise people because the medication responsible is often something they've been taking faithfully, without a second thought, for months or even years. There's a class of blood pressure medications called ACE inhibitors, angiotensin-converting enzyme inhibitors. These are prescribed extremely frequently, they're effective, and for most people they're well tolerated overall. But they carry a well-documented, class-wide side effect that's worth knowing about. They can allow a substance called bradykinin to accumulate in the body, and in a meaningful percentage of people, that accumulation is associated with persistent throat irritation, a chronic dry cough, or an ongoing urge to clear the throat. It's important to understand that this isn't an allergic reaction, and it's not a sign that anything is going wrong with your body. It's simply a known mechanism of how the medication works, and in some people, the throat and airway happen to be sensitive to that effect. Here's the detail that makes this connection so easy to miss. The side effect can take weeks, sometimes even months, to show up after someone starts the medication. So if you started a blood pressure prescription 8 months ago and your throat started bothering you 6 months ago, it's entirely possible you never connected those two events because the timing doesn't feel immediate the way a typical side effect would. Some larger studies looking at ACE inhibitor use have found that older adults appear to experience this particular throat-related side effect at meaningfully higher rates than younger patients, which makes this especially relevant for this audience specifically. If you're taking a blood pressure medication and you're not sure whether it falls into this class, your pharmacist can typically tell you within a minute or two, no appointment needed. And if it does turn out to be an ACE inhibitor, there are other categories of blood pressure medication, such as ARBs, angiotensin receptor blockers, that manage blood pressure effectively without carrying this same side effect. Whether switching makes sense for you is a conversation to have directly with your prescribing doctor. This isn't something to change on your own, but it's absolutely a reasonable and informed question to bring to that appointment. The fourth cause is one that people often dismiss as too obvious to actually matter. But the physiology behind it is worth understanding because it's not quite as simple as just drink more water. Your mucus is mostly water. Its consistency, whether it flows thin and clears easily or sits thick, sticky, and hard to move, is directly tied to how well hydrated the surrounding tissue is. A helpful way to picture this: think about maple syrup straight from a fresh bottle versus syrup that's been left open on the counter overnight. Same substance, completely different behavior. Your mucus responds to your hydration state in a very similar way. Here's the aging-specific piece that makes this more than just a generic reminder. Research has shown fairly clearly that the body's thirst mechanism becomes less reliable as we age. A younger adult typically feels thirsty well before they're meaningfully dehydrated. The warning system kicks in early. In older adults, that early warning tends to be blunted. It's entirely possible to be dehydrated enough to noticeably affect your mucus consistency and your overall comfort without ever feeling particularly thirsty. That matters because if you're relying on thirst to tell you when to drink, you're likely operating behind the curve without realizing it. A mildly dehydrated state, maintained day after day without you noticing, keeps mucus persistently thicker and stickier, and tends to amplify everything else we've talked about today, including how reflux and sinus drainage feel. A commonly referenced fluid target in clinical nutrition guidance is roughly 30 milliliters per kilogram of body weight per day, from all sources. Plain water, herbal teas, soups, and water-rich foods all count toward that total. But the habit that actually matters isn't a single large glass of water when you happen to remember. It's steady, deliberate intake spread throughout the day. The fifth cause is one that rarely comes up in conversations like this one, and I think that's a real gap because for a meaningful number of older adults dealing with persistent throat mucus, the root of the issue isn't in the throat, the sinuses, or even the stomach. It's in the gut. Here's what the research shows. Your digestive tract and your respiratory system are more connected than most people realize. They share regulatory pathways through both the immune system and the nervous system. The health of your gut microbiome, meaning the trillions of bacteria living in your intestines, can influence how reactive and inflamed your upper airways become. When the balance of that gut microbiome is disrupted, a state researchers refer to as dysbiosis, it can trigger immune responses that promote excess mucus production in the airways. Importantly, this doesn't mean anything is physically wrong with your throat itself. It means the gut is sending inflammatory signals that the respiratory system is responding to. This relationship, often referred to as the gut-lung axis, is an active and growing area of clinical research. Several peer-reviewed studies, including some published in respected respiratory and immunology journals, have found associations between gut microbiome disruption and airway inflammation. Some animal studies have gone a step further. When researchers transplanted gut bacteria from patients with chronic lung disease into mice, those mice showed measurably increased airway mucus production, which points toward a real, mechanistic link between gut health and what happens in the airways, rather than just a coincidental association. What tends to disrupt the gut microbiome in older adults? A handful of very ordinary things. A diet that's relatively low in fiber and fermented foods, repeated courses of antibiotics accumulated over the years, high sugar intake, and chronic stress. None of these are exotic or rare. They describe the everyday reality of a large share of older adults. You're not going to resolve a gut-airway connection with a throat lozenge, but you can begin supporting your gut microbiome through small, consistent daily choices, and I'll walk through some concrete options for that in the action plan coming up. Before we get to practical steps, I want to take a moment that genuinely matters. Most of the time, persistent throat mucus in older adults is exactly what we've discussed today: manageable, explainable, and not dangerous. But your body sometimes uses a symptom to flag something that needs professional attention rather than home management. Please make an appointment with your doctor promptly if you notice any of the following: mucus that's consistently tinged with blood, even a small amount; difficulty swallowing that's gradually getting worse over time; unexplained weight loss alongside your throat symptoms; a lump or persistent swelling somewhere in your neck; a significant voice change that isn't improving; These signs go beyond the scope of what we've covered today. Please don't try to work around them with home remedies. Bring them to your doctor and let them evaluate you properly. Now let's turn everything we've covered into something concrete you can actually act on. Tonight, try to stop eating at least 3 hours before you lie down. When you eat and then recline shortly after, your stomach is still actively processing food, and the valve we talked about earlier has the hardest time staying closed under that pressure. Giving yourself 3 hours of upright time after your last meal is one of the more consistently supported behavioral steps for reducing nighttime silent reflux. Elevate the head of your bed, but do it the right way. This means using a firm wedge placed under the mattress or the headboard legs, not simply stacking extra pillows under your head, which tends to just bend your neck rather than raise your torso. Even a modest incline uses gravity in your favor and can meaningfully reduce how much acid travels toward your throat overnight. Before bed tonight, drink a full glass of warm water. This small habit supports overnight hydration and helps keep mucus a bit thinner, so the morning accumulation tends to feel less severe. Tomorrow morning, before your coffee and before breakfast, drink 1 to 2 glasses of plain warm water. This costs nothing, and it begins rehydrating your body while loosening the overnight buildup of mucus before it becomes the dominant feature of your morning. It's one of the simplest changes people consistently report noticing. This week, consider picking up a nasal rinsing device from your local pharmacy, either a neti pot or a squeeze-style saline bottle. Use water that's been boiled and cooled to a comfortable warm temperature, not straight from the tap, along with a small pinch of plain salt, and optionally, a very small pinch of baking soda, which some people find helps thin mucus by gently neutralizing nasal acidity. Use it once daily, ideally in the morning, and give it a full 2 weeks of consistent use before deciding whether it's helping. As mentioned earlier, consistency is really what separates people who find this genuinely useful from people who try it once and give up. Make an appointment specifically to review your medication list in relation to your throat symptoms. It helps to come prepared with a rough timeline, when your throat symptoms started, and when you last started or changed a medication. If you're taking a blood pressure medication, ask directly whether it's an ACE inhibitor, and whether an alternative in the ARB class might be a reasonable option for you. Again, this is a decision for you and your doctor to make together. To support your gut-airway connection, try adding 1 small daily serving of a fermented food to your routine. Plain yogurt with live active cultures, kefir, or a small portion of kimchi or sauerkraut are all reasonable starting points. This is a long-term strategy rather than something that produces overnight results, but long-term strategies tend to be the ones that actually shift your baseline over months, not just mask symptoms temporarily. Set hydration reminders for yourself throughout the day, and keep water accessible in whichever rooms you spend the most time in. Eating more water-rich whole foods, cucumbers, watermelon, soups, herbal teas, also contributes meaningfully toward your daily total. Since I know many of you have already tried a few things, let's briefly go through some of the most common ones. Honey is genuinely soothing for irritated throat tissue. It's not harmful, and it can calm symptoms temporarily, though it doesn't address any of the 5 underlying causes we've discussed. Dairy doesn't create mucus out of nothing. The research doesn't really support that idea. But some individuals do notice that dairy proteins seem to make existing mucus feel thicker or heavier. If you notice a consistent pattern for yourself, a short 2 to 3 week trial without dairy is a reasonable, low-risk way to check. Apple cider vinegar is a popular online suggestion, but if silent reflux is part of what's going on for you, introducing additional acid into the system can potentially make things worse rather than better. Worth being cautious with that one. Here's what I want you to walk away with today. That persistent coating at the back of your throat has a reason behind it. Often more than one. Silent reflux happening quietly overnight, with no heartburn to warn you it's occurring. Post-nasal drip from low-grade sinus inflammation that never announces itself dramatically. A medication side effect from an ACE inhibitor that develops slowly enough that it's easy to miss the connection. Mild chronic dehydration running just below the level that would normally make you feel thirsty. And a gut microbiome sending inflammatory signals that your airways are responding to. None of these mean you're simply obligated to live with constant throat clearing as an unavoidable part of getting older. Each one has a practical, evidence-informed response, and importantly, none of the first steps require a prescription or a specialist visit to begin trying. If someone has told you this is just what happens as you age, I hope this gave you a more accurate picture. You're not just getting older in some vague, unexplainable way. There's real, identifiable physiology behind what you're experiencing, and understanding it is the first step toward actually addressing it, ideally alongside your own doctor. If this was useful, consider sharing it with someone you know who's been quietly dealing with the same thing. And if you'd like, let me know in the comments which of these 5 causes was new information for you, or if there's a related topic, like gut health or reflux specifically, you'd want covered in more depth going forward. Take care of yourself.